Do you know anyone who has used anabolic steroids to gain muscle? Also known as gym juice, this anabolic steroid promises to increase muscle mass 3 times faster than normal, but this advantage has its consequences. Today, I'm going to tell you what happens to your body when you use this substance. First of all, you need to know what an anabolic steroid is. Not everyone knows this, but our bodies naturally produce a sex hormone called androgen. The most important example of this hormone is testosterone. Testosterone is responsible for male sexual characteristics such as facial and body hair, a thicker voice, and natural muscle growth. It is specifically a male hormone, but is also produced in women, but at rates up to 20 times lower than in men. Anabolic steroids are hormones and androgens that are manufactured in laboratories. The most common steroids used by many are nandrolone, stanozolol, and oxandrolone. But do you know why anabolic steroids actually exist? The most common medical use is to replace this hormone in men who don't produce enough of it. Anabolic steroids may be prescribed for a number of medical conditions, such as helping patients who have suffered serious illnesses, such as prolonged infections, or even malnourished patients in certain types of anemia to gain weight. However, some people, especially men, even if they don't have any of these hormonal problems, start pumping themselves full of anabolic steroids. The result of these applications is high levels of these hormones, much higher than natural needs. In the past, the users were basically top athletes who wanted to improve their performance in certain sports, which is what we call doping. Nowadays, we see their widespread use by ordinary people, usually gym goers, who want to improve their performance faster and for aesthetic purposes. But be aware that their use has its complications. There are various risks and side effects associated with the use of anabolic steroids, among which I would like to highlight heart problems, such as drug hepatitis and the development of tumors, increased blood pressure and changes in the cholesterol profile, mood swings, such as aggression, as well as psychiatric disorders such as anxiety and depression, liver problems, an increase in red blood cells, which is nothing more than the formation of clots in the blood vessels, and consequently an increased risk of thrombosis. In men, the use of steroids affects the size of the testicles, making them very small, reducing the body's natural production of testosterone, and consequently the formation of sperm. In most cases, this problem with the testicles can be reversed when the man stops taking androgens, but not everyone is so lucky, and it can take a long time to normalize. Some men's testicles may remain atrophic and poorly functioning even after they stop taking the medication. Another very common effect is unwanted male breast growth, also known as gynecomastia. In women, androgens cause the male virilizing effect, leading to the appearance of hair on the face and other parts of the body, as well as thickening of the voice and growth. In adolescence, androgens can cause premature closure of the growth cartilage, resulting in a decrease in final height. There are 2 other aspects to consider. The first is the way you use it and your dependence on it. As I mentioned earlier, there are different types of synthetic androgens with different properties. Most people use several of these hormones in combination to achieve more muscle mass and the desired body definition. They do this in cycles, interspersing periods of use of one substance after another, followed by periods of no use. When faced with such high doses of these hormones, the body stops producing the male hormone testosterone. And when you stop using the steroid, there is a sudden, often prolonged drop in testosterone production known as the rebound phase. It is during this phase that the user loses control, as it can cause erectile dysfunction, loss of muscle mass, decreased or absent libido, and various other problems. All of this leads the layman to take more and more doses of steroids to avoid these problems. The longer they use these substances, the greater the risk of the aforementioned diseases, such as liver problems, anxiety, depression, erectile dysfunction, and others. The second aspect is a much debated issue among users: the dose. Is there a safe dose? Is there a safe duration of use? I've done a lot of research and I can answer that there is no safe dose or time for the use of these substances in people who are just looking to improve their physical development and for aesthetic purposes. In patients with clinical indications for their use, patients with serious illnesses, or who really need this substance, the benefits outweigh the risks. And since the patient needs it, he or she should certainly be accompanied by a qualified professional. Many other health professionals, even doctors, have their own conclusions about its use. When there is this kind of controversy, it is best to follow the advice of medical experts. Medical societies generally do not recommend the use of anabolic steroids or even testosterone in patients who do not have a deficiency of this hormone or any type of disease that could affect its poor production. These are some of the harmful effects that steroids can have on your body, and you've probably heard that there's no harm in using them, or that they can cause harm. We can't rule out the possibility that genetics also plays a big role in the effects, both good and bad. If you have any doubts, or if you are using these substances and want to stop, see an endocrinologist who is the most qualified professional to help you. Remember that growth hormones are also considered steroids and can cause the same problems as those mentioned above, and that some drugs found in drugstores can cause the same problems in excess. Anything in excess is bad for you, so only use what is recommended and when you need it. Leave your comments and opinions below, and if you already use them, leave your experience below. I hope you enjoyed today's video and see you in the next Fit Fundamentals video.